part of the examination, if that's okay. I've already washed my hands and closed the door for privacy. And I checked your vital signs and they were all normal, okay?
Sure.
So we're gonna go ahead and proceed. Including your vital signs, your vision was 20/20 with your glasses, okay? So what I'd like to do now is start by checking your hands and your nails. Okay, and I'm looking for any turgor, any kind of cracking or clubbing, and they all look fine. That looks good. Go ahead, and I'd like to start by looking at your head.
Sure.
And I'm looking to see for symmetrical hair growth, everything looks good. Any flaking, any lumps or bumps or patches of baldness, and they all look fine. I'm going to go ahead and start by checking your lymph nodes, and I'll say what I'm doing, okay? So, occipital, postauricular, preauricular, tonsillar, submandible, submental, anterior clavicle, posterior clavicular, clavicular, infraclavicular, and these ones were cervical, these are clavicular. Okay, I'd like to go ahead and start by looking at your face. It looks symmetrical. Your face, skin looks all intact, so I'm going to start touching the rest of your face, okay? Any pain, Roman?
No.
Okay, could you remove your glasses for me? Thank you. Any pain here?
No.
Good. Okay, and then Roman, can you go ahead and close your eyes tight for me? Don't let me open them. Good. Can you open your eyes for me, please? Can you wrinkle your forehead? Okay. Can you smile? Puff out your cheeks. Stick out your tongue. Good. And then can you frown for me? Okay, good. I'm going to go ahead and start by looking at the rest of your face, so that looks all intact. I'd like for you, Roman, to close your eyes and tell me if you can feel anything on your face.
Yes. Yes. Yes.
Good. I'm going to go ahead and start with your ears now. And what I'm looking at for your ears is going to look at the structure of your ears and behind your ears, any changes in the skin or any pain, and they all look normal. I'm going to go ahead and look inside your ears, and what I'm looking for are your tympanic membranes, and right now they are pearly gray, clear. I can see the cone of light, the malice, all the landmarks are noted in your ears, and right now you have no fluid and no odor to your ears. Okay? I'd like to go ahead also and do the tuning fork, and you tell me if you can hear if it's equal or one more than the other. Okay?
Equal.
Okay? And then one more here. Can you hear it?
Yes.
Okay, tell me when it stops.
Stop.
Okay, good. And then Roman, can you hear this?
Yes.
Can you hear it from here?
Yes.
Good. I'm going to go ahead over here and start now. I'm going to look a little bit more in your eyes. So I'm going to go ahead and pull the lids down, and I would have gloves on. I would wash my hands. Go ahead and pull these down. And what I'm looking for is the total eye. And so it looks good. Your conjunctiva is intact. Your sclera is white. I don't see no redness, no irritation, and you have no itching in your eyes.
Mm-mm.
Okay, good. I'm going to go ahead and do a couple more things with your eyes. I want to go ahead and do a little range of motion here. So if you can go ahead and look at my nose or look at this thing right here, and I want you to go ahead and keep looking at it. Looking, 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 looking. Good. I want you to follow the tip of this with just your eyes. Good. And then Roman, can you close one eye for me, like this? And tell me if you can see my fingers wiggling.
Yes. Yes. Yes.
Good. And I would do the same thing with the other eye, okay? You don't need to do it. We'll go ahead and I'm going to look into your eyes. Oh, excuse me, one more thing, Roman. If you go ahead and look at my nose, then look at the window behind me. Or look at my nose, and look at the window behind me. Okay, good. We're just making sure that your eyes are able to track back and forth. I'm also going to use flash some light in your eye, and I'll see if your pupils will constrict and dilate. You ready? Look straight at my nose. Good. And again. Good. I do the same thing with the other side. Another thing, Roman, I'd like for you to do is go ahead and touch my finger And then can you touch it up here? And how about down here? And over here? Good. I'm going to go ahead now and look a little bit more closely into your eyes. Okay, and then we're going to shine a light. So I'm going to get into your personal space. So here, I'm going to go here, red reflex, and then I'm going to go into your eye a little bit more, and I'm looking for the vessels and the optic disc, and they all look normal and intact. Okay? Okay, so that's with your eyes. I'm going to go ahead and move on down to your nose, but let me do a couple more things with your eyes first. So I'm just going to go ahead and cover one eye, look straight ahead, and I'm going to take it away. Same thing. Looks good. Then I'm going to go ahead and start with your nose. Okay, so what we're going to do, go ahead and occlude one nostril for me. Breathe. And the other side. Good. I'm going to go ahead and look in your nose and back a little bit. And what I'm looking for is that your mucosa is pink, your septum is in the midline, so not deviated, and your turbinates look appropriate. Okay, nice and pink. Okay, you can go ahead and breathe normally for me. Roman, I'm also going to go ahead and take a look in your mouth, okay? So if you can go ahead and open your mouth for me. Say ah, ah. And then so what I'm looking for is, go ahead and keep saying ah. Put your tongue in. And then so I'm looking at your uvula is down and it's equal in the middle. Your tonsils look fine. There's no exudate. Your palate's intact. Your dentition is appropriate. I don't see any active dental problems. Your buccal mucosa is fine, intact. Pink. I don't see any whitish on there that would indicate a cancer or any kind of infection. Your tongue looks healthy. Roman, can I look underneath your tongue? Okay, can you stick your tongue to the side? Other side? Straight ahead. Good. Those are intact. So another thing I'd like to do now, Roman, is go ahead and look at your neck and your thyroid. Okay? So you look straight for me here. I'm going to go ahead and fill this divot here. Okay, and then I'd like you to swallow for me. And again. Good, and that's for your thyroid. In your trachea, that looks fine. There's no tugging, no pulling. Here. And then so, Roman, what I'd like to do now is go ahead and do a little range of motion and some sensory with your body here.
Sure.
So I'll go ahead and do your brachial pulses first.
Okay.
Okay, radial. I'm going to go ahead and feel for this ventricular node here. And that looks fine. I'm going to go ahead and do your reflexes. So relax for me. So that's tricep. Relax, relax. Relax for me. Bicep. Relax. Radial. Good. I would do the same thing on the other arm. I'm going to go ahead and now and do the sharp and the dull test. Okay? This is dull and this is sharp. Can you tell the difference?
Yeah.
Okay, you tell me, closing your eyes, if something's sharp or dull. You ready?
Yeah. Sharp. Dull. Sharp. Dull. 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 Sharp.
Okay, good. Now we'll do the same thing with the other hand. And so we're going to do a little bit of range of motion. Roman, can you put your hands over your head like this for me and reach behind you? Any pain?
Mm-mm.
Okay, go ahead and bring them back for me. I'd like for you to make a fist or like this, a muscle. Don't let me pull your hands down. Don't let me push them up. Good. Relax your hands for me. Can you go like this with your hands? Like this? Don't let me close your fingers. Can you put your hands like this? Okay, don't let me pull them up. Okay, put your hands like this. Don't let me push them down. Okay. Go ahead and put your hands out. I'm going to squeeze my fingers. Okay, starting is good. Good. That sounds good. I'm going to go ahead and go onto your lung area here a little bit. And I'd like for you to take some, it's over. No. Go ahead and start with your lungs here. I'd like for you to say toy boat.
Toy what?
Again.
Toy what?
Okay.
Toy what?
Okay, I'm going to go ahead and press on your spine. Looks good. Okay, I'm looking at just if everything's symmetrical and your schedule looks fine, your back looks fine, including your skin. I'm going to go ahead and palpate. Good. Done. do it again.
Aspergia.
I'm sorry, that when you told me it was over.
No, I tell you, I have like 40 seconds left.
Hmm.
So wrap it up.
Dang it, sorry.
You have to do it again?